Hi, my name is Paul English. I am a medical student. Do you mind? Nice to meet you, by the way. Sorry.
Nice to meet you.
Can I ask your name, please?
It's Sarah Casey.
Sarah. Okay. Sarah, could I ask your name? Sorry, your age, if you don't mind.
42.
42. Okay. Sarah, how can I help you today?
Well, it's a little bit embarrassing. I have a bit of tummy pain and I'm suffering with a bit of constipation.
Okay.
Yeah.
Okay. And how long has this been going on?
I suppose it's been particularly bad, I suppose, for the last 3 months.
Okay.
Yeah.
Yeah. And is there anything that you're concerned about about this like?
Well, I suppose, in my dad, in the back of my head, my dad died of bowel cancer, and I suppose the fact that this is ongoing for 3 months, I'm kind of worried about it.
Okay.
Yeah.
I can see that would be very concerning.
Yeah.
But we'll go through a few things now, and we'll hopefully come find the reason behind it. Okay.
Yeah, sorry for bothering you about this.
No, don't be bothered at all. This is very important for you. So just tell me, when you say constipation,
Yes.
can you define what that means to you?
Well, I could go 4, maybe 5 days without actually passing a bowel movement.
Okay.
Yeah, and when I do, then it could be quite hard, and it hurt,
Yeah. So and when you do actually go, is it always 4 or 5 days, or like how frequently would you go to the toilet?
Well, that's the way it seems to be at the moment, is that I wouldn't go for 4 or 5 days, and then I might go, and then sometimes I might get diarrhea as well, maybe once a week. So that's kind of the pattern it's been taken for the last 3 months.
Mm-hmm. Yeah, I can understand.
Yeah.
And just, I know it's a bit strange, but could you actually describe your stool to me, maybe, if you don't mind?
Well, like, if it's a hard movement, it's just quite large and just like a block coming out of me.
Yeah.
But then if it's the diarrhea, then it just kind of comes out like gurgling and water, and it sounds disgusting,
That's okay.
I'm a bit nervous then at work as well, if I haven't gone for a couple of days, and then I'm kind of holding back in case I do go,
And worried about the diarrhea as well on top of it. Yeah, that's I can see, especially with work as well, that you'd be worried that you could suddenly get a bit of a dose at the wrong time. Yeah, that must be very, very concerning for you.
Yeah.
Just to kind of go through talking more about the stool, have you ever noticed at any stage that there was any kind of blood in your stool?
No.
Blood. And have you ever noticed kind of any mucus in it?
I haven't really noticed. It could be there, but I haven't noticed it,
Yeah, okay. So that's grand. And you were talking about that you've been getting kind of abdominal pain as well.
Yes.
So those kind of cramps as well.
Yes.
Are they there the whole time?
Well, they can be there during the day, but I don't go. But then, say if I'm going to get like a dose, a dose of diarrhea, the cramps can get very severe beforehand.
Okay.
It's like, gurgling and stuff.
So they're not there constantly. They kind of come and go in relation to the bowel movements.
Yeah.
Okay.
Yeah.
And if you were to rate them out of 10, 10 being the worst pain you've ever had?
Well, like if it's just kind of random kind of ones during the day, maybe a 2 or a 3, but if it's prior to a dose, it could be as bad as 6 maybe.
Okay.
Yeah.
And do you get that pain anywhere else? Does it kind of go anywhere else?
No, it's just all the tummy area.
Just all in the tummy?
Yeah,
Okay.
yeah.
And is there anything that makes it, like you were saying, it's kind of worse before, you might possibly get diarrhea, but is there anything that you do that can make it better or worse?
Well, if I actually have a movement, like if I have a bowel movement, that actually takes the pain away.
Oh yeah, okay.
Yeah.
And is there anything that makes it worse, like?
Well, I think the whole thing is kind of made worse with stress. You know,
Yeah.
I'm a bit stressed at work and that.
Yeah.
And the stress kind of aggravates my system. It makes me very tense, you know.
Okay. Yeah.
Yeah.
All right. Just to kind of move on a tiny bit, it's just going to ask you a few questions. Have you been sick lately? Any kind of fever?
No.
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 Have you had any kind of weight loss? That unintentional weight loss.
No.
Any
No.
in changing your appetite?
No.
No. Okay. And you were mentioning about the pain that you have in your stomach. Do you ever get pain when you're actually going to the toilet?
Only if it's very hard. It's more the passing of it.
Okay.
And I would have pain then if it was diarrhea while I was going, you know, because it's like the diarrhea cramps.
Yeah. And have you ever got any kind of rectal bleeding? Like,
No.
No. Okay.
No.
All right. So, I'll just move on to talk about another few things. Are you on any medications at the moment?
Well, I'm just on the pill, you know, the bar.
Oh,
yeah.
Okay.
Implanon, yeah.
Yeah. Okay. Yeah. And have you been on any antibiotics recently?
No.
No. And you aren't taking anything like any sort of pain medication, like?
No.
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 Okay.
No.
Very good. Do you smoke?
No.
No. Do you drink?
Just at weekends.
Just at weekends. Would you drink much?
Maybe 3 glasses of wine on a Friday and a Saturday night.
Okay.
Yeah.
And you were talking about what do you actually work as, sorry?
I work in a candle factory.
Okay.
We make candles.
Oh, very good.
Yeah.
Very good.
Yeah.
And is that stressful at all?
Well, it's not so much the work is stressful, it's just that I've been put down to a 3-day week. I was on a 5-day week,
Yeah.
and they put me down to a 3-day week for the last 3 months. And, you know, it's coming up to Christmas, and I suppose I'm kind of anxious about money as well.
Okay. Yeah.
Yeah.
I can see
It's
like
really
that's
interesting.
these are all things that are very important for you to tell us actually.
Yeah.
Because unknowns to you, they can be having an impact as well on you as well.
Yeah.
So, and also just even having these problems with your stomach as well, that can be quite stressing as well. Like,
Yeah.
So,
Yeah.
So just kind of to ask a few more things as well. You were saying, did you have any past medical history of any kind of irritable bowel disease, irritable bowel syndrome? Like, did anyone say that to you before?
No, I suppose this is the first time I've actually come about constipation. I would have suffered with it on and off in the past, but nothing,
Yeah.
it wouldn't be as long as this or as severe as this, so I've never come about it before.
Mm-hmm. And there's, it just in your family, there's no irritable bowel or any inflammatory bowel. Do you know, you might have heard of things like people say about ulcerative colitis or Crohn's disease.
No.
There's none of that in your family.
No.
Is there any kind of cancers, like especially like
Just
colon or bowel cancers?
Just my dad.
Your dad, is it? Okay.
Yeah, my dad.
Yeah.
My dad passed away of bowel cancer.
What age was he when he got that?
He died when he was 70.
Okay.
Yeah.
And that's what's kind of concerning you as well, the tiny
It
bit
is,
as
you
well?
see, it's
Okay.
in the back of my head as well, do you know, that he passed away. I know he was a good age, but, do you know, it's there always with me, you know.
Yeah, that's fair enough.
Yeah.
And have you done any travelling recently?
No.
Okay. And have you been in contact with anyone that has any diarrhea or anything like that?
Oh, like I picked up something or something?
Yeah.
Yeah, no.
No, not that you're aware.
No.
Okay. Right.
No.
And is there any stress at home other than the ones that you've told me already?
Oh, it's just more financial, really. You know, we needed, like, we were managing, when I was on the 5-day week, but we're finding it hard to manage now, to be honest, after that I'm on the 3-day week.
Mm-hmm. Yeah, that's no problem. I can see that all that is adding to probably this.
Yeah.
So, what we're going to do is, do you have any questions for me?
I suppose I was wondering, should I get that camera test done? I don't know very much about it, but I hear people get, you know, a camera test to see if there's anything going on inside in them.
Mm-hmm. Yeah, no problem. That's something that we will look into, but we might do a few more kind of investigations ourselves
Okay.
before that.
Okay.
Oh, one other question that I have. Do you have any thyroid problems? Did anyone ever say that to you?
No.
Okay.
No.
Yeah. No, that's what we'll do is we'll do a few tests, but
Okay.
at the moment I'd like to actually just maybe examine, just have a feel of your stomach,
Okay, doctor.
and we'll have a listen as well for any kind of bowel movements and stuff. Is that okay?
Okay.
All right.
Okay.
Great.
Sorry, doctor.
Okay, Sarah, so after examining you and from what you've told me in the history as well, like from just talking to you earlier, I get the feeling that this could be what's known as irritable bowel syndrome.
Okay.
And what basically is it sometimes it can be just, it can give you cramps, you can get problems with both constipation and diarrhea.
Okay.
And you also can get quite a lot of abdominal pain and bloating.
Actually, I do have bloating. Now that you say it, I do have a lot of bloating as well, doctor.
Yeah. So that can be, and what irritable bowel is as well is it can be something that's brought on by the different foods that you eat.
Okay.
It can be worse when you have a lot of stress in your life.
Yeah. I do have a lot of stress at the moment. Yeah.
Yeah. So. And a number of other things as well can play a role. They don't exactly know what causes irritable bowel, so it's kind of more it's something that we treat by treating the causes. So we try to, if you find out different foods that it can trigger, you can try to eliminate those. So we might. What I was going to do is we could also kind of do a dietary history from you.
Okay.
And we could, I could put you in contact maybe with a dietitian as well.
Okay.
And they could give you ideas of what to eat and what not to eat.
Okay.
And then in regards to your stress, obviously it's a stressful time for you as well at the moment. So basically it might be good to get you to talk to someone as well and just to go through the various kind of stresses that you have at the moment. And just even having this irritable bowel, it can, we found that a lot of people can feel quite upset, and they can have, there can be sometimes a bit of depression that can be mixed into it. Okay. So basically the way we're going to treat it is we're going to manage it a number of ways. So treat it by going to a dietitian. Okay. We'll try to work on your stressors, so the things that are kind of stressful towards you. And then we can work on things like if you are actually finding that you feel quite upset about things, we can see about if you need to be put on any medication for that as well. So, are you feeling in a way? Is there any kind of depression at all in you?
No, I didn't feel I was depressed. I suppose I do feel a lot of stress. I'm not sure who I would talk to about being stressed. I don't know how I will sort that out, because it's not your department.
I can put you in contact with someone if that's it.
Okay.
And the other things, obviously, because they don't know exactly what causes irritable bowel, we have to go about ruling out other causes before we can say that's the definite cause. Okay. So, I'd like to do a few blood tests. I want to check. Have you ever been checked for anything like celiac disease? No. So we could do something like do a celiac check as well. Okay. To check for that. Okay. We could check your bloods for kind of thyroid function as well, because that can sometimes cause some of these symptoms. Okay. And we can do the likes of do an X-ray, and it can look for kind of signs of colitis that might be suggestive of other things. Okay. And so we'll do some bloods. We can also look into tumour markers. As you said, you have in a past history of colon cancer.
Yes, my dad.
Yeah, so we can look at some of those tumour markers as well on top. Just to rule out any kind of cancer possibly, just to alleviate, because that's causing a stress on you as well.
Yes, because it's at the back of my mind. And is that a camera test? Is that the camera test then, or what's that?
So we can do a colon. It's called a colonoscopy. It's where they put a camera up and they look at the lining inside your kind of bowel. Okay. So, and they'll tell you all about that when I refer you on as well.
Okay.
Okay. Do you have any questions about any of that?
I suppose it's just to find out why my bowel system is this way, constipated, diarrhea, whatever, and you've discussed the different options there, what roads we're going to go down, and I'm kind of glad that you're going to do the camera test, because at least that will rule that fear out of my head, you know.
I didn't ask you as well earlier. Do you have any sort of heartburn or any kind of? You haven't vomited at any stage?
No.
Okay.
No.
Very good. No, because I meant to ask you that as well.
Okay, yeah, sure, doctor. No, nothing like that.
Great. I think that's the way we should go about doing this. Okay. And what I'll do is I'd like to see you back in a few weeks to look over these test results.
Okay, so you're going to do the blood tests and stuff now?
We'll do the blood test now, and then I'll I'll send off a referral to get the colonoscopy and a bit of was it an abdominal X-ray as well done.
Okay.
So does that sound okay?
Yeah, sounds great, Doctor. You're very good. Thank you very much, Doctor.
Thanks, Sarah.
Thanks, Paul. So you took a history off Sarah there, and it was very good. You worked through it very well. I mean, I think irritable bowel syndrome type histories, they're not easy histories to take. So I think you did a very good job overall. Specifically in your history, you know, you worked through all of her symptoms. Again, sometimes embarrassing symptoms for patients to discuss. So I think you made her feel very at ease there, reassured her that there was, you know, that it was something that would make her feel uncomfortable. You saw that, but you know, trying to take that discomfort away somewhat. So that was very good. And you elicited her concerns, you know, with respect to you know, the fear of cancer very early on. So that was a very good thing to get out, because she automatically kind of, I would imagine, felt quite relieved by that. And then you worked through the different differentials very well. Just, I suppose, you know, looking at specific aspects of the history, you got in there, you sought out the red flags. That was very good. A few things maybe that you could concentrate on in future histories like this would be, I suppose, the stress aspect of it is a huge contributor to symptoms in irritable bowel syndrome, and it's something that she brought up a few times before. I think you really kind of drilled down on that, and gave her the chance to talk about the financial concerns and the work being cut down and the impact that was having on home and family. So you definitely got there, which is good. I think she was kind of flagging it to you. She flagged it to you a number of times before you kind of gave her the chance to talk about it. So just something to bear in mind. If you hear the patient bringing up the stress thing, just to give them a chance to talk about that a little bit more.
Okay.
Similarly, you know, a 42-year-old lady, so it's important just to think about the gynae side of things and the menstrual history and things like that. So Sarah actually has an implant on, so I mean, you could be fairly confident that there was nothing serious going on from that point of view, but always just remember that when you're taking female histories, the abdominal kind of area. And again, I mean, you demonstrated great empathy with her when she was discussing her dad. I felt maybe moved on a little bit too quickly then to ask her, had you been travelling or anywhere exotic recently? Again, it's an important part of the history. You needed to make sure that you ruled out weird and wonderful causes of infectious diseases, but just to make sure to tread very gently when people are talking about recent bereavements or family bereavements. But all in all, I think, you know, very, very good history and very compassionately done, very comprehensively done. So now just to talk about your management a little bit. So just do you want to tell me what your top 2 or 3 differentials are first of all, and then we'll talk about how you're going to manage those.
Yeah, so at the moment irritable bowel will be my top differential. But as I was there's a lot of what you mentioned, the alterating constipation and diarrhea, the feeling of bloating, a bloating feeling, abdominal pain, and all of those would be suggestive of irritable bowel.
Yeah.
And because she has a lot of things that also, like the stressors, so she gets stress in her life, there's a link that they say between hormones as well and irritable bowel. So like she's the hormones being a female as well, and then on top of that there's a few other things that also would play on to suggesting that it's irritable bowel. Other things that I wanted to rule out were, do you want to check for any signs of like H. pylori or anything like that? So because she has a family history of colon cancer, you'd want to rule that out by doing a colonoscopy and a bit of a biopsy as well.
Okay.
So yeah, all of those.
Yeah. Is there anything else that you would do differently about your management plan there, or is there anything you'd change about it at all?
I think with my management plan, since I'm focusing on irritable bowel as being my main differential, I think the plan is quite good. Starting with the dietitian, getting to know the foods that can cause problems.
Yeah.
That will help if it ends up that it could be a celiac cause as well on top. So then you should know what kind of triggers. So for some people it could be curries or other things like that.
Okay.
Then obviously she'll just be aware that she needs to decrease the stress in her life as well, and all these will help.
Okay, so that's good. I mean, you took a nice holistic approach to looking at all the different contributing factors. I think it was also good that you're taking the steps to rule out the more important, physical or pathological causes that were there. You mentioned X-rays. What X-rays were you thinking about doing for this lady's diarrhea and constipation?
I was thinking an abdominal X-ray.
Okay.
And you can kind of look for any kind of signs of colitis. You can look for. You could go into doing a barium enema.
Okay. So plain film is probably not going to show you too much in this situation. So that might be another just a learning area, a learning need for you to go back to and maybe just have a look at the kind of appropriate use of radiology in abdominal pain. Plain films not so much. There are other options that you could consider, but that would be something I definitely revise later on for you. And then just the one other point is you brought up tumour markers with her. This lady was concerned about a history of malignancy, so that probably didn't come out of the blue too much for her. But it is a term I would use very, very carefully when you're talking to patients, because if they're not thinking about malignancy and you say you're going to do a blood test, well, tumour markers, it can cause an awful lot of anxiety and stress. So just to be very, very careful about the words that we use around investigations as well. So they would be the two things that I would focus on from that aspect of things.
Okay.
Okay.
Brilliant. Thanks.